Now, in terms of drugs, unfortunately, there are no disease-modifying osteoarthritis drug yet. In other words, a drug that can truly delay or reverse the progression of the condition. And so all the drugs are really more for symptom relief rather than disease-modifying. So that's something that is quite sobering, because in today's context where we have so many drugs for the other arthritis condition, for OA, we haven't found the holy grail, which is a drug for it. Now, what we still give is analgesics, in other words, paracetamol, tramadol, and so on. These actually are pain relievers that are effective. Paracetamol needs to be taken about 2 to 3 times a day and 2 tablets each time for it to be effective. So we try to advise the patient who have bad knee pain or osteoarthritis pain to take the paracetamol more regularly. Actually, the topical creams, non-steroidal anti-inflammatory drugs creams are very effective as well. So do use it. Capsaicin is one of those that are not so common. It's actually chili. So when you apply this capsaicin cream, you feel the burning sensation of the chili ingredient in it. And that actually distracts the pain pathway a little bit. But we don't use it in Singapore very much. Then, as mentioned, the non-steroidal anti-inflammatory drugs are very helpful. So things like Stimflex, Ponstan, ibuprofen. Then, of course, the COX-2s are the ones that does not harm the stomach so much. For example, the Celecoxib and Etericoxib are also well known as Celebrex and Arcoxia. And then some doctors may give glucocorticoid steroid injections. This is usually when the joints are fairly swollen and we need to give rapid pain relief. But it usually lasts only for 1 to 2 months. And sometimes there's always a risk of aggravating the progression if this is given too often. So we try to give maybe less than 3 times a year. Then there's another injection, which is artificial joint fluid. It can be a hyaluronic acid. And this actually has some evidence. I'll show you how useful it is later. And of course, some of you are familiar with the nutraceuticals, the supplements like glucosamine and chondroitin. Again, this one, we tend to suggest maybe try it for 2 months at the right dose, which is 1500 milligrams a day. And if it doesn't work after 2 months, don't waste money, because only about 50% of the patients feel that it works. Yeah, the rest actually didn't feel it's helpful. So injections, as mentioned earlier, we can give it into the first, the big thumb. It can also be given into the knee. And of course, we give the injection, then we continue to do the physiotherapy and all that, so that they actually will strengthen the joints after that, and hopefully the pain will not come back again. As mentioned earlier, it only lasts between 1 to 2 months. Yeah. And we try not to do it too often, and never give oral systemic or oral glucocorticoids or oral prednisolone to our patients, because it actually can cause more side effects than benefit. Now, for this particular study on hyaluronic acid or another a product called Synvis, it has been shown to be effective. But the problem is that it can, when given to people with fairly severe osteoarthritis, only about 60% will respond. And among those who respond, it will only last for about 6 months. Yeah. So therefore, it has to be given fairly frequently, and it's not cheap. So again, it's not a good solution for most people. Then in terms of the topical pain relievers, that means the creams, actually is quite useful. And in fact, I do use this quite a bit, and some patients like it as well. Then of course, as mentioned earlier, for the glucosamine or chondroitin, we should give at the adequate dose, usually 1500 milligrams for up to 2 months. Thereafter, if it doesn't work, I tend to suggest not to continue. One other drug that sometimes we have no choice but to use is the opioid analgesics. This is a stronger pain reliever. Things like oxycodone, even morphine, and so on. But in Singapore, we tend not to use it so much because there are a lot of problems. For example, you need to use higher and higher dose. There's tolerance. The patients can get addicted if they are not using it for pain. And then sometimes in the very old patients, it may suppress the breathing. So it's actually a bit dangerous. And of course, very commonly cause constipation, which is a big problem for older people.